regulate our intervention and our treatment. Cardiac CT for calcification scoring is a convenient and non-invasive way of evaluating whether you may be at increased risk of heart attack. The exam takes less than 10 minutes, causes no pain, and does not require any injection or contrast material. No radiation remains in the patient's body after a CT examination. X-ray used in CT scan usually have no side effects. So, looking at the outcome of this disease, calcium scoring is the first line of detection to prevent heart disease. There is only a slight chance of cancer from excessive exposure to radiation. However, since we know that the benefit of an accurate diagnosis far outweigh the risk, if we're going to die at 48 of a massive heart attack, well, you don't even have to worry about the radiation. So you need to get that test done early so that we can prevent, you know, the progression of the disease. The effective radiation dose of this procedure is about 2 on the score of 2, which is about the same as the average person received from background radiation in 8 months. Women should always inform their physician, of course, if you're going to have any testing done, whether you're pregnant, whether you're lactating, all these things are very important. CT scanning is in general not recommended for pregnant women, unless medically necessary. If the disease is going to kill you and you're carrying a child, well, get the calcium score. A high calcium score may sometimes be followed by other diagnostic states for heart disease, which may not be necessary and might cause side effects. Now, there was a study done at the University of Maryland where they looked at calcium scoring. And it was a small group, but it was fairly significant. They looked at people who had negative, they did the calcium scoring, and they also did the other study, which we're going to talk about. Because that next study does have some side effect, but it's a very important study. But they looked at patients who had, they took patients who had cardiac problem, and they did a CT calcification. And when they looked at the calcification, and it was 0, it correlated 100% to the PET scan, which was negative. So maybe that test is going to become the mainstream test without having to use other tests to look at the progression of the disease and how we interfere in the disease process with bringing in our interventions. So the other test that we need to talk about is the cardiac PET scan. The system is called rubidium PET CT scanning. It's a combined test. It's a combined test where you are injected rubidium, which is a tracer, and at the same time you have the position, the CT scan, which is rotation, and give us information about your arteries. In less than 1 hour, this non-invasive imaging technology helps doctors to make a precise diagnosis, which is the first step for providing excellent patient care. Because you might see problem with the heart, but how are we going to treat that patient? Is this patient going to be medical? Is it going to be, are we going to have to put stent in this patient? Are we going to do angioplasty? Or does this patient deserve surgery? So we have to be very, very astute at looking at exactly what is the part of the heart that is a problem, and is it scarred? Because if the myocardium is dead, and you have blockage of the artery leading to that particular dead area, it doesn't make any sense to revascularize with surgery because it's dead. So it might prevent you of surgery. So the PET scan, the cardiac PET CT combined with the CT angiography that is going to take a look at that vessel on end and all the area of the heart is critical. Because then we know exactly where it is and what is the degree of occlusion. PET CT scanning can also establish baseline blood flow measurements so that as we go along, we know exactly how the patient is progressing. Individuals who are studied today and are told to change their diet habits, increase their exercise, and take medication to reduce their risk factor artery disease can be scanned a year later to see what has happened. This type of imaging could help us to get ahead of heart disease. and possibly reverse the process of atherosclerosis early. Dr. Dilsizian from the University of Maryland says that it adds that PET-CT scan can be useful in tailoring medication dosage to treat heart disease by comparing baseline images to scans after medical therapy. A coronary CT is a heart imaging test for non-invasively determining whether either fatty deposit or calcium deposit have built up in the coronary artery, which supply blood to the heart. This is a test where you can see the problem. To see the problem is critical. You can go and get the EKG and the echo and the stress test, and the stress test is important because stresses can give us a lot of information, but in women, stresses have a lot of false negatives. So you have a normal stress test, but you have heart disease. So we need something more earlier to take a look at those vessels, to take a look at the problem that we can fix. If left untreated, these areas build up called plaques can cause heart muscle disease. Heart muscle disease in turn can lead to fatigue, shortness of breath, chest pain, and heart attack. Because remember, if you don't do nothing about atherosclerosis, it's going to progress. That artery is going to be completely blocked. And remember, if you have atherosclerosis in your heart, it's a systemic disease. Your carotids start to plug. Your arteries going to your kidneys start to plug. Your brain arteries start to plug. It's systemic. If you're eating bad food, it's not just affecting your heart. It's affecting your entire system, all your organs. So all that information needs to be addressed early on, and the pathology must be detected early. So if we can see the problem and intervene early, this is what we want to do. Traditionally, doctors have been waiting for patients to develop symptoms before we start to be aggressive. We know atherosclerosis starts early. There was a large study where young soldiers died in the war, World War II, and they received autopsy. They already have plaques in their 20s. Okay? Now, they were under a lot of stress, but remember, it takes years to develop atherosclerosis. And we can pick it up early with the calcium scoring. And we can take a look at it. If we need to intervene,